Australia's medicinal cannabis sector is at a crossroads. Today, patient demand is rising, regulation is lagging, and the TGA is reviewing the system. So the question today, what comes next? I'm Aaron Young, and this is Cannabiz in Conversation. Always great to be with you. And as the industry heads to Brisbane for the United in Compassion conference, today's episode is examining the reform debate and what is being proposed to protect patients and ensure sustainable access. To unpack it further, we are joined in the studio by Teresa Nicoletti, the chair of the Australian Medicinal Cannabis Association, and Dr. Priya Ayar from Relief Australia. Beaming in from London there is Cannabis's Martin Lane, and from Sydney is Professor Nicholas Lintzeris from the University of Sydney. Welcome to you all. Martin, I'd like to start with you and I guess address whether the special access authorised prescriber model is suitable for medicinal cannabis when it comes to its current form.
Thanks, Aaron. Well, that's the question the TGA is currently trying to answer, of course. There is a general consensus that medicinal cannabis use has grown far beyond original expectations, and that this has placed a strain on the current system of regulation and indeed the GPs and patients using it. We think it's vital to include healthcare practitioners at the coalface in that conversation, which is why we've invited Nick and Priya along to join us today.
Yes, and Priya is a great place to start. I'll ask you this question, of course. As a GP, can you, I guess, briefly outline how medicinal cannabis is prescribed in Australia and what are the main challenges with what we currently have?
Sure, of course, Aaron. So at the moment, medical cannabis is prescribed to patients, firstly, that have a chronic disease or chronic condition. They had to have trialled a first-line medication at first, and only then they might become eligible. The process of prescribing with doctors apply for what's called a SASB application, special access scheme from the TGA to be able to assess and prescribe for these unapproved medicines currently. And from there, once they get the approval, we can go ahead and prescribe. A number of the doctors have now gathered enough SASB applications and have become authorised prescribers, which are more experienced in the field, such as myself. We can go ahead for certain conditions and apply without having to go through the special access scheme and go ahead and prescribe for these patients that are eligible.
Nick, I want to head to you in Sydney there. There have been suggestions some providers target recreational users and are prioritising profit over patient care. Some say it's widespread. Do you think it's as widespread as what others believe?
So we don't actually have great data about what's going on out there. Certainly there will be examples of individuals who may not have a strong case for a medical condition that for which medical cannabis can be effectively used for, that have been able to find their way to getting a prescription. I think, though, that all the signals that we have is that this still remains the minority of people. When we survey people that are being prescribed medicinal cannabis, the vast majority of them report that their cannabis use is being used for medical reasons, very small amount being used for non-medical reasons. I think the concern arises is that there are so many people in Australia that have used cannabis. So the household survey tells us between 10 to 15% of Australians over the age of 14 used cannabis in the last 12 months. So that's a lot of people. And so you can see there the demand that's going to arise, because in those household surveys, when they ask people, is this for medical reasons or for non-medical reasons, a considerable proportion are saying it's for medical reasons. So a bit under a third, so about 25-30%, are saying it's for medical reasons. And of those people, the vast majority are saying they have not had it prescribed for them. They're still using illicit cannabis, but for medical reasons. So I can understand that there are concerns that there's a lot of people being prescribed. Many of them will have a history of cannabis use, illicit cannabis use. I think what we're seeing, though, is the crossover and the conversion of a lot of people that were using illicit cannabis and now moving over to regulated medical cannabis. And the vast majority of them appear to be doing that for medical reasons.
And Nick, I guess give us a bit of an idea of what it means for the patients and also the products and doses they're being prescribed. What do we know?
So when we look at the data that's available, both from the TGA and also from surveys and research, what we're seeing is that there's, for those individuals who have a history of cannabis use before they had it prescribed, so these are people that were using illicit cannabis, many of them for medical reasons or for non-medical reasons, we do see a higher proportion of those patients are using THC-based medicine, so they'll have some THC in the medicine that they're prescribed. And we're also seeing probably higher rates of people using flower products, flower or herb for vaping.
Very interesting indeed. Teresa, I'm going to bring you in here if I can, because I want to understand what reform, from your perspective, should actually look like.
So, Aaron, any regulatory reforms must consider foremost public health and safety.
Of course.
And so, in the context of medicinal cannabis products, what we want to see are improvements in the quality and safety of those products. And so we want to strengthen that base, but we also want to strengthen the evidence base, because the more data that we have about the quality, safety and efficacy of medicinal cannabis products, the more we can make properly informed decisions about how to regulate these products. And one thing we do need to recognise with medicinal cannabis products is that we have an established framework where hundreds and thousands of patients are being prescribed medicinal cannabis. So the most important aspect of any reforms is to ensure that they are transitioned slowly and that they are proportionate and that they do not compromise access to medicinal cannabis.
It's such a fascinating point you make, and Priya, something I'd like to ask you about, I guess, the human cost of restricting access here as well. What do we know?
I mean, there could be a very high human cost if restrictions were to be too much red tape. I mean, there are so many genuine patients and that are doing so well on the therapy, and we would hate for additional, hurdles and red tape to be in place and be able to restrict the access to those patients that would need and do best on the treatment.
Teresa, is it all about balance here? Is it about making sure we talk about access and safety and evidence as well, and making sure the data is there and that it is balanced?
It is very much about balance and proportion. And the biggest concerns about the introduction of reforms in a scheme that has now been legal for 10 years almost is that there is a large segment of the patient community who are being prescribed medicinal cannabis products and are deriving benefit from it. And so there are always improvements that we can make to the regulatory framework, particularly around quality and safety, such as improving labelling and dosage guidelines to inform prescribers and pharmacists so that they can prescribe appropriately to patients. And there are weaknesses in our education of medicinal cannabis prescribers who have not that much knowledge about the endocannabinoid system and the hundreds and thousands of different variants of medicinal cannabis products that are out there.
I guess the big hope is that one day it'll all work together.
And that's what we're working towards. So the sector organisations are trying to work as closely as we can with regulators to support that process. We're very supportive of regulatory frameworks, but we emphasise the proportionate decisions that do not compromise access.
All right, let's head back to Sydney now. Nick, from your perspective, what risks could restricting access to medicinal cannabis actually create for patients? Do you agree there with what we're hearing from Priya?
Very much so. It also depends on what kind of restrictions. If it's restrictions, for example, in having sort of less THC available and will prioritise CBD, unfortunately, they're different medicines, and so they're not interchangeable. So it's not as though we can say, well, we'll crack down on THC but make CBD available. It doesn't work like that. They're different medicines and they're used in different ways. So they're not interchangeable. The real concern is if there was a marked reduction in access, one or two things will happen. Either there will be patients who will no longer be able to access medicinal cannabis, and that will have impacts upon their health. The alternative is that there will be people who, if it's no longer available to be prescribed legally, will end up resorting to black market, to illicit supplies. Now, again, that's not something that we can encourage. There are so many problems with illicit markets. No one knows what products they're getting. There's contamination in the products. It requires people to be breaking the law. It requires people to then start mixing with criminal milieus who may then be involved in also moving other drugs, selling other drugs. So you're moving into sort of a black market. One of the extraordinary successes of what we've seen over the last decade is that we've seen a large proportion of people who were using illicit cannabis have transitioned over to regulated legal supply, and the vast majority of them saying it's improvements in their health, in their social well-being. So we don't want to turn back on that.
Very well said. Martin, I want to get your final thoughts here as well on what we have heard in the program today and the concerns. Do you see this as an opportunity now for Australia to set global benchmarks around medicinal cannabis access? What can be done? What does the future look like?
Absolutely, and I think it's really important to acknowledge, the industry acknowledges that the system needs reform, but wants to work with the TGA and sees this as an opportunity, not a threat. So we put forward proposals which aim to protect patients and practitioners, surface more evidence, and lift safety standards. I think it's vital we get this right so people can continue to access this life-changing medicine safely.
Wonderfully said. And of course, for everybody joining us from Sydney through to London there, Martin, and here in the studio, Teresa and Priya, really appreciate all of your insights. Thanks so much for joining us on the program today.
Thanks, Ronald. Thank you.
Thank you.
All right. Cannabiz in Conversation is presented by Medicinal Cannabis Industry Australia and the Australian Medicinal Cannabis Association. You are watching Ticker. We'll be right back.